Oliver, Navicent Health. All the hospitals in Central Georgia have been working in close collaboration, including my colleagues here, Steve Daughtry from Coliseum Health Systems and Charles Briscoe from Houston Healthcare. I would also like to acknowledge Laura Gentry from Peach, Todd Dixon from Navicent Health Baldwin, Gina Tipton from Navicent Rehab, Lorraine Smith from Monroe, and Alan Horton from Putnam. The health of our community and the safety of our employees and patients is our primary concern. For this reason, we are jointly instituting an essential visitation policy at all Central Georgia hospitals to go into effect tomorrow. There will be limited visitation for essential visitors only, and Charles will discuss this in more detail in just a minute. All facilities will have limited entry points, and visitors and employees alike will be screened for symptoms of coronavirus infection, such as fever, cough, and shortness of breath. And if they exhibit any of these symptoms, they will be denied entry into the facilities. As everyone is aware, COVID-19 pandemic is serious, and as such, we need to take steps as a community to stop its spread. At this time, there is no proven effective treatment other than supportive care. Although the majority of those that contract this virus will have little or no symptoms, some people, a small percentage, may become seriously ill and can even die. For this reason, it is important to limit the spread of the disease. We can do this by keeping a safe distance of 6 feet or more from each other, avoid large gatherings, and practice effective hand hygiene. Wash your hands frequently with hot water and soap for at least 30 seconds and try not to touch your face. Hand sanitizer can also be effective, but should be at least 60% alcohol by volume. Our hospitals are doing our best to be prepared. We have many dedicated, well-trained nurses, doctors, and other healthcare providers to care for you should you need our services. Thank you, and keep you and your family safe. Charles, can you tell us more about the visitation policy?
Sure, thank you, Dr. Holler. Our health systems are in agreement that limited visitation is the best for our community at this time. As mentioned earlier, beginning tomorrow, Wednesday, March 25th, only an essential visitor will be permitted per patient at all of our hospitals. An essential visitor is defined as someone who meets the following criteria: accompanying a minor patient, visiting a patient at the end of life, assisting a patient who needs a healthcare decision maker, or help with communication or help with mobility, with a patient in labor and delivery or at a family birth center, or is with a patient in intensive care. We all understand this is unprecedented times, and these are unprecedented decisions we're making here today. But as healthcare providers, we know interacting with your loved ones can be helpful for healing, and we want to appropriately balance your access as a visitor with the overall need for the community to manage this COVID-19 situation. We encourage our patients to use technology with their loved ones, including phone calls and video chats, to remain in contact. At the end of the day, we must all work together to fight against the COVID-19. And with that, I believe Steve has some additional comments for us.
Thank you, Charles. Local hospitals routinely make decisions to ensure the health and safety of patients, staff, and visitors. As things continue to change with COVID-19, we're making necessary changes to our policies to match CDC recommendations. These new visitation policies and actions are designed to safeguard the entire community. Coliseum Health System, Houston Healthcare, and Navicent Health appreciate the community's cooperation and understanding during the efforts to mitigate the spread of COVID-19. We recognize that interacting with loved ones can be helpful to the healing process and strongly encourage everyone to utilize other forms to support their loved ones, including phone calls and video chats on cell phones and other mobile devices. With everyone working together, we can flatten the curve. For the latest information on hospital responses to COVID-19, including visitation policies, please visit our hospital websites. Thank you for your continued effort to help support our community and each other. And I want to thank Charles Briscoe from Houston Healthcare and Dr. Tom Oliver from Navicent This is a time when we are not competitors. We're here for the safety of our community. Thank you.